See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shawna Butler.
Hey, podcast listeners. It's Shawna Butler, host of See You Now. When we first aired the episode, Pause for a Moment, with nurse Jonathan Bartels back in February 2020, when the world was in a different place, we were already speaking to the experiences of nurses who, when faced with death and dying of their patients, were pressed for time. Time to care for each patient and their family. Time to reflect and process on each loss. And time to grieve. We introduced the episode by sharing that when a patient dies during resuscitation measures, clinicians don't always stop and reflect. Typically, they walk away. They have to move on to the next patient. They may be frustrated because they were not successful in saving that life, or they may have to rush to get home. Little did we know that soon we would be in the grips of a global pandemic that in less than 1 year has taken the lives of over 1 million people. The pause we talk about in this episode plays an even greater role now, not just for the nurses and healthcare teams who use this as part of their practice, but for all of us. It may seem like an abstract concept, but seeing the pause in action is quite remarkable. In the recently released documentary, In Case of Emergency, which follows emergency nurses and their patients in 7 unique settings across the U.S., we see the pause in the context of emergency care, and it is profound. The film captures the dynamic nature of how nurses innovate in real time to respond to this pandemic and any and all public health crises, and makes strikingly clear that during this pandemic, nurses are operating at a superhuman capacity in the face of insurmountable odds. You can watch the film at incaseofemergency.film. This pandemic has changed what it is to die in hospitals and forced nurses to not only innovate the end-of-life experience, but also to shoulder so much more of it. Families are not at the bedside to share in sacred and final moments. Intimate goodbyes are spoken over the phone as nurses hold both the phone and the hand of your loved one. Friends, family, clergy, those who helped each other through grieving before, also help the nurses, doctors, and the hospital staff. And they're not there now either. But the anguish is there, and it is overwhelming from the staggering frequency and suddenness of loss. Jonathan's words ring true now more than ever.
The real mindset behind the practice itself is to really address caring for ourselves while we take care of others. The practice of the pause is not a panacea. It's not going to cure everything. It's only a first step.
We wanted to return to this episode before the launch of our Season 3 to remember that we need tools and skills to help us in this crisis. The pause is a practice that gives us a moment, a powerful and potentially restorative moment, to process the magnitude of what we are individually and collectively experiencing.
If you do this work and you come to this job and you think you will walk in and walk out and nothing will touch you, it's like going into water and walking out and thinking you're not going to get wet. We all get wet. It's how we dry off. How do we take care of ourselves? How do we heal so that we can continue to heal and care for others?
Drying off, as Jonathan said, has hardly been a priority in the past. And now, more than ever, it is important to rethink, redesign, reimagine, and take time, however difficult, to pause.
My name is Jonathan Bartels, and I am a palliative care liaison nurse at the University of Virginia Medical Center. I am also the liaison for the Compassionate Care Initiative at the School of Nursing here at the University of Virginia Medical Center. And I am the individual who innovated a practice called the pause. And the pause is a practice that we do in the setting after a patient dies to provide honoring and to do it in silence so that everyone in the room can have a voice.
Jonathan, how did nursing find you?
Nursing hunted me down. I started in healthcare.
That's a very ominous image.
Well, in a good way. But nursing, I started as an orderly in a small Catholic hospital when I was 18. And it was hard back then. That was the height of HIV. That was the patient loads were huge. The work was really intense. And I remember a nurse telling me one day that I should never, ever consider nursing as a career. And this poor nurse was burned out. She was exhausted. And so I took a circuitous route and continued to work in healthcare, but avoided nursing as a profession until the day I cared for my 36-year-old brother who died of a glioblastoma. And the experience of offering care, offering vigil, offering support was a pivotal moment in my life. And it drove me towards nursing because I felt if I could do that for my own brother, I could do it for anyone's mother, sister, brother, or father and offer them the same care. And that's been my mantra and my driving force for the last 30-odd years.
I have been really looking forward to a conversation with you, Jonathan. I came across your work and your idea, and it was something that really, it was a moment and an experience that I have felt too many times as a nurse working in emergency care, in oncology care, where we are at the moment of someone's, their life has come to an end. And not knowing exactly what to do with that. And in the oncology unit, it was very different because oftentimes that person and their family and the people who loved them and they loved were people who were known. And there was a relationship that was established. And it was hard in a different way than it was in an emergency setting where it's an acute episodic event. Didn't really know them, didn't really have a connection to them, but certainly had a sense of loss and concern. And also, I got to move on. I've got to go see the next person and take care of what their needs are. And looking around at my colleagues and wondering, how do we talk about this? Are you feeling what I'm feeling? Is it okay to express emotion? And it wasn't until I read your account of a similar situation and an approach to that experience that really gave me a tool. So describe that practice of what has become known as the pause.
So the practice itself is, initially, it was a practice within the ER when someone passed away, when we worked on them and they died. And so the practice goes something like this. Before we leave the room, could we take a moment to honor this person in this bed? Would that be okay? And we wait for people to respond. And some people may say, I've got to go. Some people and some families may say, I wish you would not do that at this time. And it gives them permission to say no. But oftentimes people say yes. And the ones that say yes stay. And when they stay, I then would say something like, before this individual came into this hospital, They were alive. They were loved by others, and they loved others. They lived a full life. And now they're no longer here. Now they're gone. And if we could honor the work that we did to try to save them, the care we provided, and if we could also honor their family that's left behind, and do this in silence, and do it in your own way, and hold that space and honor it, if we could just do that for 30 seconds or a minute, would that be okay? And then we take that minute and we hold that space.
And how do families respond to this? What are the range of responses?
I've never personally, in my own experience, had a family say no. And I've heard and had it reported to me that families actually feel honored themselves in the practice. They feel like their loved one meant more to us than just another patient and another body. They felt like it brought something to them, a closure and a level of respect that they were able to bear witness to.
Tell me about your experience in developing the pause.
I'd done some work with Roshi Joan Halifax. I'm sure you've heard of her, but she had done a lot of resiliency work since 75, and I'd gone to one of her retreats on being with dying. And I was exposed to a lot of different techniques, a lot of different means to approach resiliency, and a lot of, cathartic grief work myself. And I was just amazed. And when I was done, Roshi Joan Halifax had made a mandate. She said, you all are going back to your places of work. You have to now make a change. You have to make a difference so that the benefit you received here will now help other human beings in your work area and your support. A lot of the people I was on the retreat with were predominantly physicians and nurses, but they worked in end-of-life care. And I was one of the lone wolves that worked in emergency care. And so I kind of had to look at this mandate and try to figure out how can I apply this in the environment I am working in. And so I went back into the ER, back to work with a new kind of vision of trying to find gaps, trying to find where would something like assisting others fit in to support my peers. And a pretty mass trauma came in. It was a mass casualty. And we had one of the individuals we were working on. And it was intense because we really worked hard on this particular individual. And in the end, of course, everything we did was for naught. And it was just the way it was. Her injuries were far too extensive to fix, even though we tried our best. And at the end of it, I noticed a chaplain kind of stand up. She'd come in the room late and she said, before anyone leaves, I want to do a prayer. And so she stopped the room, and I was like, wow, that's really bold, stopping the room. The prayer that she didn't meet my needs because I was of a different faith. And I just felt kind of, well, that was cool. What can I do better? And how can I make this act of stopping and this act of honoring a more inclusive act? And that's where the inception of the pause came from.
So as they're offering this prayer and this moment, in what ways did it not meet your needs?
Well, for me, I come from a different tradition. So the languaging that was used in the prayer didn't speak to me. And I knew there were others in the room that were actually agnostic or who had no faith at all. So the words themselves rang untrue to them because the language was very much in a Godfather kind of language. And that means a lot to a lot of people that have that particular faith and they bend towards that genre of belief. But for those in the room that it didn't speak to, like myself, I felt like I could do it a little bit differently. I had an extensive background in comparative religion and anthropology before I became a nurse. And so I relied on that knowledge to really adapt the actual practice.
When I'm listening to this, and as I was initially came across this and reading this, I sense that the effort and the intention was to address the sometimes despair that healthcare professionals and team members feel when you do have a death, when the outcome is not what you intended. Was that your initial prompting, was to really help team members?
No. My prompting was to help myself. And it was a practice that would at least meet the needs of what I felt I needed to have met. The result of that, by offering myself that compassion, has spread to include everyone in the room, to include all my team members, and even to include those that are on the periphery, who are standing outside the room, maybe a security officer, maybe if it's at a scene of an accident, maybe it's the neighbors, maybe it's extended family. But the level of offering that compassion has spread beyond just myself to anyone who applies the practice and owns the practice. And it allows them not only to offer it to themselves, but it does build a team. And it was not necessarily the intent in the beginning. But in the end, I realized, wow, this is much bigger than I thought it was.
That's an interesting observation that I think what happens oftentimes is you know what your own truth is. And if you have an honest exploration with it, oftentimes what you can offer is, this is what's happening with me. And maybe this is resonating with somebody else. And it sounds like that may have been this experience. I've seen the pause or heard people practicing this in so many different settings, in so many different instances. So you've planted these seeds and been very generous in sharing that. What has blossomed? What's come back to you?
It's. I liken it to throwing a rock into a calm lake, and the ripples just spread. The kind of interconnectedness of the experience has gone far beyond what I was capable of imagining it could. And the lives it touches, I don't go a day or two without someone stopping, and if they know who I am, which is the beauty of being myself at this point, is that my practice that I help inspire is famous, but I am not. I'm invisible. And so when people find out I'm the guy behind it, they come up and they share stories. I had a medical student just the other day come up and he said, "Man, thank you. They did that for my dad after he died, and I'll never forget that." And so I get these vignettes. I was in Boston, and I was speaking at a compassion conference. They were doing research on the pause, and I was part of the advisory committee for it. And I was presenting my material, and at the end, this woman who was dressed in a hijab, and she was Somali, she came up to me and she said, "Thank you." And I said, "No, thank you." And she then proceeded to tell me a story of how she works actually in a refugee kind of healthcare setting. And people come from all over the world. And she said they come here and they're traveling. Anyone who comes to me tells me their story. And they tell me their story of surviving violence, sometimes surviving rape, and they unburden it onto me. And I usually stop them and I say, could we take a moment and just honor the path you took to get where you are right now? And they hold that space. And that just blew my doors away. I was like, wow, that is beautiful. And it's not necessarily the pause for the end of life, but it's a pause to honor the struggles of another human being, and to connect in that way. It's really powerful.
You mentioned research on the pause. Can you say more about what the research is being focused on?
An acquaintance of mine, Tim Cunningham, who's now at Emory, he's has a doctorate in nursing, was doing research on the spread of the pause. So what he did was connect and reached out to several different continents and different areas where he found out the pause was. And then he interviewed the people who are practicing it to find out a broader meaning of what it means to those individuals, as opposed to what my intent was when I started it. Now that it's spread so much, to really get information about what the practice means for those around the world that are practicing, and how does it affect them, and is there a universal definition of what it means to practice a pause? We're still waiting on data on that to come back. The research that they did at the Compassionate Care Institute at the University of Virginia was using a mock scenario in a simulation room in which there was an untoward death, and they had an actor who actually played the part of a nurse, and she would implement the pause for half of the practice and then not implement the pause for the other half after the death, and trying to find out if that affected, or were there biologic responses from the team after being exposed to the pause. And so we're still waiting on that information to come back as well.
Sadly, we see stories in the news on a too regular basis on the rate of clinician burnout, just how the demands, the urgency of need, being asked to do more, people not getting the care that they need, difficulties with getting it insured, and just how that has a huge impact on health professionals' health, well-being outlook, and how it causes them to have what is referred to as burnout, or deciding to leave the profession or the practice, and for, sadly, some to take their own lives. How is this practice addressing the emotional needs and well-being of team members?
I'm glad you asked, because someone actually asked me that in Boston, and I didn't know if it was on the day of National Suicide Awareness Day. And I hadn't thought about it. And since then I have. The practice of the pause is not a panacea. It's not going to cure everything. And it's only a first step. The real mindset behind the practice itself is to really address caring for ourselves while we take care of others. And so I liken the practice itself to, being a finger that points the way to what we all should be doing. And I'm not sure what that'll look like for any one individual, because we all approach resiliency and self-care in a lot of different ways. But if the pause can help someone just briefly, for a moment, hold a space and heal in that moment, maybe it'll set a pattern for them to look further into how much more they can care for themselves. We in healthcare are very prone to blaming if something goes wrong. And sometimes things go wrong and we don't necessarily have the solution, and we may not be the cause. And so I'm hoping through just this one practice, it opens people's perspectives more to what more can I do for myself? Not to take on more work, but how can I treat myself in a different way so that I can sustain myself in the work I do.
I'm thinking about how this is, as you mentioned, like throwing a rock into a calm body of water, has just rippled across the landscape and people using this to great benefit. And one of the partners I've seen is the Cleveland Clinic, how they have brought that to their entire team, a very large team across their institution. How are they using this as an institution?
What they've done, and often a lot of people at my behest, I request that it not be protocolized or made into a protocol. This is an invitation to practice. And what they've done is really disseminated access to the practice across their whole East Coast health system. In doing that, they're educating their employees to say this is a practice you can apply during your everyday practice and care of patients if someone were to die. And so they've really done a masterful job of disseminating that across their institution. Other areas and what I've done and really the spread of the pause has been a grassroots spread, and it's really been through the word of mouth. And what Cleveland did was kind of make that mouth a little wider and a little louder for their employees.
And as you've had others join in, have you had team members or support that are untraditional or non-traditional team players? Or, have you reached out to other disciplines to help you develop the pause, to think about its dissemination?
It developed so organically, but the invitation was such that I've had respiratory therapists implement after a death. I've seen housekeepers call for and do. I've seen nurses' aides speak up and ask for it. So it's a real kind of universal practice that levels the playing field. It doesn't have to be implemented by a physician. It doesn't have to be implemented by a nurse. It just has to be implemented by a team player or someone on the team.
And other disciplines outside of traditional healthcare, have you found them reaching out to you or incorporating or offering assistance to help build this?
I've heard, actually the first time I heard this was from a colleague in South Africa. She said this major veterinary provider had now taken on and implemented the pause within their veterinary practice. That was one of the most outlying things I would never have thought to have happened. But like the woman from Somalia who implemented a type of pause within her care every day for these refugees. The pause, I always stress, it's important we do it after a death, but it's also something that we can apply in our everyday, in what we do, how we approach, in entering a room. Do we pause? Do we stop? Do we set our intention and then move forward? It can be applied in a multitude of ways.
So what's the role of technology in, to your point, grassroots? That's an interesting mix, using grassroots and letting this evolve as it will naturally unfold, but using technology to give it a form that might be more available.
The technology aspect of it, which I find, again, a lot of things have unfolded without me preparing for them to unfold this way. It's just a natural unfolding. Is the technology is allowing people to have access to the practice, to have access to suggestions on how that practice might unfold within their own group and their own caretaking. And the technology itself is allowing for lots of people look for templates to use. And this technology that we've tapped into will allow them to look at a template, to find the words they may not be able to find in their own selves during these moments after people die.
When we're using the word technology, what form is that taking? I've seen or heard about the use of something that's based in an app that's available on a mobile phone. What technologies are helping to support people who want to use the pause?
Well, I initially, when I started the practice, I wanted to make this a universal practice, and I wanted it to not necessarily be owned by one institution, but to be owned by the practitioners themselves. And so I personally had started a self-funded webpage, and that's where Cleveland got a lot of their information was from the webpage, where I give the information away for free. And by doing a website, I was able to really disseminate more information about the pause by reaching out to individuals and pointing them towards that source of information. So they were able to access and get information and see the video on the site, and also have a means to contact me if they wanted to have further instructions or support in trying to implement it in their own institutions. And that has led to this new app that'll be another means to really disseminate that knowledge and give it away for free.
What will we find in it? What's the user experience?
The user experience is they'll find instructions regarding when to implement the pause, how to implement the pause, and what words to use when doing it. And that's the gist of what the app will provide.
You're listening to See You Now. I'm Shawna Butler. You can find the Pause app for the pause practice in your app store. That is a mouthful, guys, but it's developed in partnership with Round Glass. If you just search for the Pause app by Round Glass in your browser, you'll find it and you'll love it. Now, let's get back to our conversation with Jonathan Bartels. He's an emergency department nurse and a palliative care liaison at the University of Virginia Medical Center. We're talking about how he developed the practice of the pause. So on the back end of that, that sounds like it's going to be rich with data, downloads, where they're coming from, how long people are using it. Do you foresee that data being able to give new insights into other needs or other opportunities to help people support their emotional and mental well-being?
It definitely will. It will also track where people are actually looking to try to support themselves in a better and richer and deeper way, which will provide institutions and healthcare systems means of really identifying the needs of their employees and where they can maybe enhance or add to further practices that can support them.
You know, as you mentioned, it took you into unexpected places. And as you see that this has impact, what are some of the things that you've learned that surprised you?
I think the one thing that is almost a Captain Obvious moment, but I thought the pause was a Captain Obvious moment until I realized others were not practicing. But it's the fact that so many people within healthcare are suffering. So many people have been suffering in silence. And so many people are just starving and reaching out for anything that can help ease that. The weight of what we do in healthcare is tremendous. As you know, the weight is huge. And how many of us have been taught that this is going to be a byproduct of what you do? I don't think I was taught at the onset, and I had to learn by the practice.
I think my experience with that was there is discussion. There is awareness that says this is hard work, emotionally, spiritually, physically, intellectually. But I don't know that even those words prepared me for what those experiences are. They are hard. It is hard being in those spaces where there's just a loss and a hurt that cannot be erased. You will live with it. It will mark you. It will shape you. And so I don't know that even with the best preparation or training that you're fully prepared for what that emotional experience will be like, or the physical experience either.
No, but the invitation, I think, from the get-go in education to care for ourselves and to stress that is something that really needs more integration, really needs a look at it in a deeper way. Because, as you said, it forms, it shapes, it sculpts us on both a psychological and maybe even a psycho-spiritual level of just being shaped and molded by these life experiences, and to also find ways and paths to be able to walk through and walk out. When I often present, I say, if you do this work and you come to this job and you think you will walk in and walk out and nothing will touch you, it's like going into water and walking out and thinking you're not going to get wet. We all get wet. It's how we dry off. How do we take care of ourselves? How do we heal so that we can continue to heal and care for others?
And when we think about the language that gets used around technology, innovation, the fast pace, the how do we do more? How do we get more accomplished? And there is such a pace and an urgency. What are you up against when you are in a message and a dialogue and a narrative that says, let's stop, let's pause?
My argument would be quicker is not better. An increased pace does not necessarily mean a better outcome. We have to approach things intentionally. And in doing it intentionally, it might be a little bit slower than the rapid pace that technology may want to be pulling us towards.
At that moment where an unexpected death happened and you had this insight of, I need something here, which then turned into an idea and now is having great impact. What are you, having gone through that experience now, what are the other avenues of impact that you foresee the pause having?
Well, another lesson or point of being is the pause is, and I don't think I'm alone. I tried to think about that from a phenomenologic standpoint. The pause happened. And now you're seeing other practices come up. I don't know if you're aware of the honor walk that's come up after someone dies or they're about to donate their organs. And I think it was started in Oregon. Nurses will walk the patient and physicians will walk the patient's family down to the surgical suite, and the staff in the hospital will stand on either side all the way down and honor that patient and that family until they get to the point of donation. These practices of bringing ritual back into a healthcare system, but back into a society, rituals are there to heal. And I think the pause will inspire other type of rituals to return back into our environment to help us support each other and support our patients.
Yeah, it is a really interesting paradox with technology and finding and having our humanity flourish within it, and also embracing it without losing our humanity. And I have seen some of these honor walks that have been recorded and shared. And when I think about that very special moment, the technology that can capture it and can share it and can have it spread could also be that same technology that...
It's also there.
Yeah. It is an interesting contradiction in some ways. And I think it's the responsibility and the opportunity for people, citizens, caretakers, guardians, stewards, to use that technology in service of humanity. And I'm so thrilled, and it's been interesting to see where and like I said, your initial insight and need has turned from an idea and a practice into a movement that has spurred other movements.
Thank you.
So you have a really good experience in having difficult conversations. And Michael Hebb's new program designed for healthcare professionals, Death Over Dinner, and how do we have these critically important conversations? How did you end up getting involved with that, and what's your role?
So Michael reached out to me because he saw a symbiotic relationship between what he was doing and the work I had done with the pause. He felt like it was a great marriage to keep these together. I think Michael brought a ritual in such a way to allow people to broach and talk about the subject of death. And what he saw in my practice was the different ritual, but still bringing together and acknowledging that death is present, that we will all face it one day, and that we should honor it whenever we are confronted with it.
How do you describe Death Over Dinner and that experience?
Death Over Dinner gives you a means to share not only food, but conversation, and feelings and emotions around a topic that we will all cross, that we will all go through, that we will all be touched by, and that's death. And Michael's Death Over Dinner gives you a venue in which to address those issues, to support each other, to hear each other out, and to give voice and give space and give honoring to the concept of death that we will all eventually have to face.
I've been to one or two of the dinners that have been orchestrated by Michael, and I have to say they're not at all what I expected. They are the most beautiful conversations, the most meaningful conversations, and not as difficult as I thought they would be. Has that been your experience?
Definitely. It's not, people think it's going to be so morbid. I haven't laughed as hard as I have at one of those dinners just because there's life there. We're talking about a subject that we'll all pass through, but we're all alive and we're doing it while we're alive. So it's really an opportunity to grab that juxtaposition of death and life, and to really embrace life and living and sharing. It's beautiful.
What are you excited about as far as next steps?
I think I'm excited about just the potential for the future and not knowing what these other sort of rituals will be, these self-healing, self-care, how they'll manifest within our healthcare institutions. Will they inspire the same knowledge that you suggest regarding the use of technology, how they're doing it now, and metamorphing that into a means that we can actually express and project and hold the concepts of compassion and self-care and care of others. I think the future is wide open, and I think the potentials for that are only limited by our capacity to imagine them.
Well, thank you so much for spending time in conversation with me. This has just been a treat and a delight, And who would have thought that spending time thinking about dark, difficult moments could be so uplifting, but it certainly has been. So thank you for the work that you do, Jonathan.
And thank you for the opportunity to give voice.
Jonathan Bartels is an emergency department nurse and palliative care liaison at the University of Virginia Medical Center. You can find more about his work on our website, seeyounowpodcast.com. You'll also find a link to his article, The Pause, that was published in the Critical Care Nurse Journal in 2014. It was that article that brought Jonathan to my attention, and honestly, it rocked my world. Value-based care is often expressed as a financial equation, better outcomes at lower costs. But there is also innovating for human values, something that nurses are particularly skilled at, innovating for inclusion, dignity, belonging, safety, compassion. This interview reminded me that there is so much more to innovation than developing shiny new products. With the prime value placed on efficiency and speed, taking a pause is an innovative and revolutionary act. It's an act of slowing down to acknowledge and restore our humanity. A time to reflect on the fact that we will lose people, no matter how hard we try to save them. And it's a moment to honor life in the wake of its absence. I'm Shawna Butler, and this is See You Now. Thank you for listening.
See You Now is created in collaboration with Johnson & Johnson and the American Nurses Association. Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. To learn more about these programs and See You Now, visit seeyounowpodcast.com.